Welcome to Damal Consult Career Academy, your go-to channel for job interview success. In today's video, we're focusing on the top 10 theater support worker interview questions and answers, especially for those applying to roles within the NHS or private hospitals. If you're preparing for an upcoming interview, this video will guide you on how to respond confidently, professionally, and effectively. We'll also share proven tips to help you understand what the NHS is looking for and how to make your answers stand out. Let's help you walk into your interview prepared and ready to succeed. 1. Can you tell us about yourself and your experience relevant to a theater support worker role? My name is Thomas, and I have over 5 years of experience working in clinical and healthcare support roles, including over 2 years supporting theater teams in a hospital environment. I am passionate about delivering high-quality patient care and providing efficient support to surgical staff before, during, and after procedures. In my most recent role as a healthcare assistant in the surgical unit at Mercy General Hospital, I worked closely with theater staff, anesthetists, and recovery nurses. My responsibilities included preparing the theater by ensuring all instruments, equipment, and supplies were sterilized and ready for use. I also assisted with patient positioning, moving patients to and from the theater, and ensuring all safety protocols, such as infection control and manual handling procedures, were strictly followed. I've been involved in maintaining the cleanliness of the operating environment, handling surgical instruments carefully, and supporting with stock management and equipment checks. I take pride in being reliable, organized, and calm under pressure, especially in high-stakes situations like emergency surgeries. Over time, I've built strong teamwork and communication skills, working effectively with surgeons, nurses, and other support staff. I have also completed relevant training including infection prevention and control, manual handling, theater protocols, and basic life support. I'm now looking to progress further in this field and bring my experience, attention to detail, and commitment to patient care into a dedicated theater support worker role within your team. 2. What do you understand about the role of a theater support worker in an operating theater? A theater support worker plays a vital role in ensuring the smooth, safe, and efficient running of the operating theater. The role involves supporting surgeons, anesthetists, nurses, and other clinical staff before, during, and after surgical procedures. From my understanding, key responsibilities include preparing the operating theater by ensuring all necessary instruments, equipment, and sterile supplies are available and properly set up. This also involves checking and cleaning equipment, moving and positioning patients safely, and helping to transfer them to and from the theater. During surgery, a theater support worker may be responsible for fetching additional instruments, assisting with the preparation of patients, and ensuring the environment is kept clean and sterile. After the procedure, they help clean the theater, dispose of clinical waste appropriately, and prepare the room for the next procedure. The role also includes maintaining accurate records, following strict infection control procedures, and adhering to health and safety guidelines at all times. Communication and teamwork are essential, as the role requires close collaboration with the surgical team under pressure. Ultimately, a theater support worker contributes directly to patient safety, dignity, and care, while ensuring that operations run smoothly and without unnecessary delays. Before we proceed further in this video, if you're currently preparing for a theater support worker role, then this is exactly what you need. Our 50 Theater Support Worker Interview Questions and Answers ebook is now available for instant download. Click on the sealer or fourth wall link in the description box below to grab your copy. It's very affordable, and we're currently offering a 70% discount, so don't wait. And there's more if you're interested in a few extra interview tips, plus a free PDF with 10 bonus interview questions and answers. Just send us an email or a quick WhatsApp message. In addition to our 70% discount, we've got a special bonus offer. buy one, get one free. When you purchase any of our ebooks, you'll get one extra ebook of your choice absolutely free. Just send us an email or WhatsApp message after your purchase, letting us know which bonus ebook you want, and we'll deliver it to you within 48 hours. You can also join our exclusive WhatsApp group to connect with others preparing for the same role. The link is in the description below. Want personalized help? Book a one-on-one coaching session with us using any of the links in the description box. To order now, visit Sealer.co or click the fourth wall link. For any questions, chat with our online support on WhatsApp or email us. Don't miss out. Get your copy today and ace your interview. 3. How do you ensure infection control and hygiene standards are maintained in a theater environment? In a theater environment, maintaining infection control and hygiene standards is absolutely critical to protect both patients and staff. I follow all hospital protocols and standard operating procedures strictly, including wearing the correct personal protective equipment PPE such as sterile gloves, gowns, and masks. Before any procedure, I ensure that the operating theater is thoroughly cleaned and disinfected, and that all surgical instruments and equipment are properly sterilized and stored in sterile packaging. I check expiry dates on sterile packs and ensure they have not been compromised. During surgery, I support the surgical team by maintaining the sterile field, making sure not to touch sterile equipment unless I'm gloved and scrubbed in, and by assisting with positioning and moving patients in a way that doesn't compromise cleanliness. After procedures, I help with the safe disposal of clinical waste, sharps, and used linen in line with infection prevention policies. I also assist with cleaning the theater thoroughly to prepare it for the next procedure, ensuring that all surfaces, floors, and reusable equipment are disinfected properly. I've completed training in infection prevention and control, and I regularly update myself on best practices. I understand that even the smallest lapse in hygiene can lead to serious complications, so I always remain alert, responsible, and proactive in keeping the theater environment safe and sterile. 4. Describe a time you worked under pressure in a clinical or fast-paced environment. One particular situation that stands out was during my time working at St. Luke's General Hospital as a healthcare assistant supporting the theater team. We had an emergency case. A patient needed urgent surgery due to internal bleeding following a road traffic accident. At the time, the surgical team was already engaged in a scheduled procedure, and we had to prepare the second operating theater in record time. I was responsible for helping to set up the operating room, ensuring all necessary instruments were sterilized and ready, assisting with the safe transfer of the patient, and supporting the team with equipment setup. Despite the urgency, I stayed calm and followed emergency protocols carefully. I worked closely with the scrub nurse to check and arrange surgical tools, ensured that the environment remained sterile, and followed instructions from the anesthetist and lead nurse to position the patient correctly. Thanks to clear communication and effective teamwork, we were able to prepare the theater in under 15 minutes, and the surgery began promptly. The patient's life was saved, and afterwards, the surgeon praised our ability to respond quickly and professionally under intense pressure. That experience reinforced my ability to stay composed, prioritize tasks efficiently, and work collaboratively in fast-paced, high-pressure clinical environments like the operating theater. 5. How would you handle confidential information about patients and surgical procedures? As a theater support worker, I understand that handling confidential information with care is a critical part of my responsibility. Patient details, medical histories, and information about surgical procedures are extremely sensitive and must always be protected. I would ensure that I follow all relevant data protection policies, including the principles of the UK Data Protection Act and NHS confidentiality guidelines. I would never discuss a patient's condition, treatment, or Any surgical procedures with unauthorized individuals, whether inside or outside the hospital. If I need to discuss patient information with colleagues for care-related reasons, I would do so discreetly and only in appropriate, secure environments. I also understand the importance of storing records and documents securely, whether they are in paper or digital form. If I ever witnessed a confidentiality breach, I would report it immediately through the correct channels, as protecting patient privacy is vital to maintaining trust and professional standards. Maintaining confidentiality isn't just a legal requirement, it's a matter of respect and dignity for the patient, and I take that very seriously in every aspect of my work. 6. What steps would you take to prepare an operating theater before and after surgery? As a theater support worker, ensuring the operating theater is clean, sterile, and fully prepared before and after surgery is a crucial part of patient safety and infection control. Before surgery, I would begin by thoroughly cleaning and disinfecting all surfaces and equipment to maintain a sterile environment, following infection prevention protocols. I would then ensure that all surgical instruments, trays, and materials are properly sterilized and laid out according to the surgeon's checklist. This includes checking that suction machines, diathermy units, and lighting are functioning properly. I would also verify that personal protective equipment (PPE) such as gloves, gowns, and masks are available for all staff involved. I would double-check the patient's identification, consent, and surgical site marking, ensuring everything aligns with the checklist and hospital policy. It also makes sure the patient is safely transferred into the theater and correctly positioned according to the surgical procedure. After surgery, I would assist with safely transferring the patient to the recovery room, ensuring all monitoring equipment and documentation follow the patient. Then, I would begin cleaning the theater by disposing of used materials, instruments, and sharps following proper waste disposal protocols. I'd clean and disinfect the theater again thoroughly to prepare it for the next procedure, ensuring that all reusable instruments are sent for sterilization and equipment is reset or restocked as needed. Attention to detail, infection control, and following hospital protocols are key at every stage. I always ensure that everything is prepared, not only to support the surgical team, but to prioritize patient safety and comfort throughout the entire process. 7. How do you prioritize tasks when assisting multiple theater staff or teams? When assisting multiple theater staff or teams, I prioritize tasks based on 3 key factors: urgency, patient safety, and team communication. First, I always make sure to understand the surgical list and schedule for the day, so I'm aware of the timing and order of procedures. This helps me anticipate the needs of each theater team and be proactive in preparing equipment, instruments, or trolleys in advance. If I'm assigned tasks by different staff at the same time, I assess which one is most urgent or time-sensitive. For example, if a theater is about to start an operation, setting up and ensuring sterility will take precedence over restocking or administrative tasks. I also maintain clear communication with the operating department practitioners and nurses. If I'm unsure which task to do first, I don't hesitate to ask for clarification or let them know what I'm currently handling so we can agree on the best order to complete everything safely and efficiently. Ultimately, my goal is to stay organized, remain calm under pressure, and support the smooth running of the theater by being flexible and responsive to the team's priorities, without compromising safety or sterile procedures. 8. Have you ever had to deal with a challenging situation with a colleague or senior staff member? How did you handle it? Yes, I have experienced a challenging situation with a senior staff member while working as a theater support assistant at General City Hospital. During one of our morning surgical preparations, a senior nurse who was under a lot of pressure due to a tight surgery schedule mistakenly accused me of not sterilizing one of the instrument trays. Although I had completed the sterilization process earlier that morning, I understood the high-pressure nature of the environment and remained calm and respectful. Rather than becoming defensive, I politely reassured her and offered to double-check the tray immediately to ensure patient safety was not compromised. I also showed her the sterilization log I had signed, which confirmed that the task had been completed. She later acknowledged the mistake and appreciated how professionally I handled the situation. The procedure went ahead without delay, and the experience helped build mutual respect between us. From that incident, I learned how important it is to stay composed under pressure, communicate clearly, and focus on resolving issues quickly in a high-stakes environment like the operating theater. 9. Why do you want to work as a theater support worker? I want to work as a theater support worker because I have a strong interest in supporting surgical teams and playing an important role in delivering safe, high-quality patient care. I'm drawn to the fast-paced, structured environment of the operating theater, where attention to detail, teamwork, and patient safety are critical. I'm passionate about making a meaningful contribution behind the scenes, helping prepare operating rooms, transporting patients, setting up equipment, and ensuring everything runs smoothly before, during, and after procedures. I find it very rewarding to know that the work I do, even if not always visible to patients, plays a key role in supporting their recovery and the success of surgical procedures. With my strong organizational skills, calm approach under pressure, and a commitment to maintaining infection control standards, I believe I would be an asset to the surgical team. I also enjoy being part of a multidisciplinary environment where collaboration and clear communication are essential. Ultimately, I see this role as a valuable opportunity to contribute meaningfully to patient outcomes and develop further within a hospital setting. 10. How do you ensure patient safety and dignity while transporting or supporting them before and after surgery? Ensuring patient safety and dignity is one of my top priorities as a theater support worker, especially during such a vulnerable time as surgery. Before transporting a patient, I always begin by checking the patient's identity against the theater list and wristband to ensure accuracy. I confirm key details such as the patient's name, procedure, and any allergies, as well as gain consent and reassure them about the process ahead. I make sure the bed or trolley brakes are secure and that all necessary safety equipment, like side rails and call bells, are in place and functioning. While moving the patient, I communicate clearly, speak calmly and respectfully, and explain each step of what I'm doing. I cover the patient appropriately to maintain their privacy and dignity, and I am especially mindful in mixed-gender areas. I take care to avoid any sudden movements or discomfort, and always follow proper manual handling and infection control procedures. After surgery, I make sure the patient is monitored carefully while being transported back to the recovery room or ward. I check for post-operative needs, such as pain levels, nausea, or the presence of drains or catheters, and report any concerns to the appropriate staff immediately. Throughout, I maintain a supportive, calm presence to help reduce anxiety. In every situation, I aim to treat patients with empathy, maintain confidentiality, and follow all clinical safety protocols to support their well-being and recovery. Do you have any question for us? Yes, thank you. I do have a few questions. Could you tell me more about how new theater support workers are supported during their induction and training period? Also, how does the theater team typically handle high-pressure or emergency situations? And what role would I play in supporting the surgical team during those moments? Finally, how is success measured in this role? What would you expect a new theater support worker to achieve in their first few months? And that's it. The top 10 theater support worker interview questions and expert answers to help you pass your NHS interview. If you found this video helpful, be sure to like, share, and subscribe to Damal Consult Career Academy for more interview tips and career guidance. Feel free to leave a comment below if you have questions or need help with any specific role or interview situation. Thanks for watching, and best of luck with your theater support worker interview. You've got this.